Welcome back to Natural Health Solution. This is Dr. Anderson. Today we're tackling one of the most misunderstood organs in the human body, the thyroid. This tiny butterfly-shaped gland in your neck has enormous influence over your metabolism, energy, weight, heart, and even your mood. But thyroid disorders are surrounded by confusion and myths. Millions of people suffer from symptoms without answers. In this video, we'll break down the truth about thyroid diseases, treatments, and the nutrients that can make or break your thyroid health. By the end, you'll have the most complete guide on YouTube, simple, scientific, and practical. Let's start with the basics. The thyroid is a small gland located at the base of your neck, just below your Adam's apple, and it's shaped like a butterfly. It's part of your endocrine system, which is a collection of glands that produce hormones. Now, this gland doesn't just act on its own, it's part of a sophisticated feedback loop with your brain. The pituitary gland, a pie-sized structure at the base of your brain, acts as the master controller. It releases a hormone called thyroid-stimulating hormone, or TSH, when your body needs more thyroid hormone. The pituitary sends out TSH to tell the thyroid to get to work. Once it receives the signal from TSH, the thyroid gland produces two primary hormones, thyroxine, also known as T4. Now, let's move on to what happens when this delicate system goes wrong. We'll cover the most common thyroid diseases, their symptoms, and what causes them. First up is hypothyroidism, which means you have an underactive thyroid. This is the most common type of thyroid disorder. When your thyroid doesn't produce enough hormones, your body's processes begin to slow down. The symptoms can be subtle at first, but often become more pronounced over time. You might feel persistent fatigue that sleep doesn't fix, experience unexplained weight gain, notice hair loss or thinning, suffer from constipation, and even battle with depression or brain fog. The number one cause of hypothyroidism in places with sufficient iodine is an autoimmune condition called Hashimoto's thyroiditis. In Hashimoto's, your own immune system mistakenly attacks your thyroid gland, gradually destroying its ability to produce hormones. Treatment for hypothyroidism is generally straightforward and involves taking a daily medication called levothyroxine, which is a synthetic form of the T4 hormone, to restore normal hormone levels. Regular blood monitoring is crucial to ensure the dosage is correct. On the opposite end of the spectrum is hyperthyroidism, or an overactive thyroid. This happens when your thyroid gland produces too much hormone, sending your body into overdrive. The symptoms are often the mirror opposite of hypothyroidism. People with hyperthyroidism may feel anxious, irritable, or nervous. They might experience unintentional weight loss despite an increased appetite, feel hot all the time, have a rapid or irregular heartbeat, and notice tremors in their hands. The most common cause of hyperthyroidism is another autoimmune condition known as Graves' disease. In this case, the immune system produces antibodies that mimic TSH, constantly stimulating the thyroid to produce more hormones than the body needs. Treatments for hyperthyroidism aim to reduce hormone production and can include antithyroid drugs, radioactive iodine therapy to shrink the gland, or, in some cases, surgery to remove part or all of the thyroid. Beyond these two main conditions, you might also hear about goiters and thyroid nodules. A goiter is simply an enlargement of the thyroid gland. It can occur with both hypo and hyperthyroidism, or even when hormone levels are normal. Often, it's caused by an imbalance in iodine, which is a crucial building block for thyroid hormones. Thyroid nodules are lumps or growths that form within the thyroid gland. They are extremely common, and the vast majority, over 95%, are benign, meaning non-cancerous. However, they always require a proper evaluation, usually with an ultrasound and sometimes a biopsy, to rule out any risk. This brings us to the topic of thyroid cancer. While the word cancer is always scary, most thyroid cancers have an excellent prognosis. The two most common types, papillary and follicular thyroid cancer, account for about 90 to 95% of all cases. These tend to be very slow-growing and are highly treatable, especially when caught early. There are also rarer, more aggressive forms, like medullary and anaplastic thyroid cancer, which require more intensive treatment. The key takeaway here is that early diagnosis through a physical neck exam and imaging is vital for the best possible outcome. So, how do doctors diagnose and manage these conditions? Let's talk about the treatment pathways. The diagnostic process almost always begins with a series of blood tests. The most common test is for TSH. However, a comprehensive panel should also include free T4 and free T3 to see how much hormone is actually available for your body to use. For suspected autoimmune disease, your doctor will also order tests for thyroid antibodies, such as TPO and TG antibodies for Hashimoto's, and TSI for Graves' disease. If a physical exam or blood tests suggest a problem, the next step is often imaging. An ultrasound is a non-invasive way to get a detailed look at the thyroid structure, identify nodules, and check for enlargement. A radioactive iodine scan can help determine if nodules are hot, overproducing hormones, or cold, underproducing, which helps assess cancer risk. If a suspicious nodule is found, a fine needle aspiration biopsy is performed. During this procedure, a very thin needle is used to collect a small sample of cells from the nodule, which are then examined under a microscope to confirm if they are benign or cancerous. Once a diagnosis is made, the medical treatments are tailored to the specific condition. As we mentioned, hypothyroidism is managed with hormone replacement therapy. Hyperthyroidism is treated with anti-thyroid medications, radioactive iodine, or surgery. For advanced thyroid cancers, there are also targeted therapies and chemotherapies available. The most important point to remember is that there is no one-size-fits-all approach. Each condition, and indeed each patient, requires a personalized treatment path based on their specific lab results, symptoms, and overall health. While medical treatment is the cornerstone of managing thyroid disease, we cannot overlook the powerful role of nutrition and lifestyle. Let's dive into the key nutrients that support a healthy thyroid. Iodine is absolutely essential for producing thyroid hormones, but it's a Goldilocks nutrient. Both deficiency and excess can be harmful. In developed countries, deficiency is rare due to iodized salt, but it's important to be mindful of your intake. Selenium is another critical mineral. It acts as an antioxidant, protecting the thyroid tissue from damage during hormone production, and it plays a vital role in converting the inactive T4 hormone into the active T3 form. Brazil nuts are an excellent source. Zinc and iron are also important cofactors in the hormone production process. Deficiencies in either can contribute to hypothyroidism. Vitamin D is crucial for supporting a balanced immune system, which is especially important for reducing the risk and severity of autoimmune thyroid diseases, like Hashimoto's and Graves'. Finally, omega-3 fatty acids, found in fatty fish, like salmon, are powerful anti-inflammatory agents that can help calm the inflammation associated with autoimmune thyroid conditions. In terms of lifestyle, managing stress through practices like yoga or meditation, getting adequate sleep, and avoiding unnecessary exposure to radiation are all supportive habits. And let us do some myth busting. Cruciferous vegetables like broccoli and kale are perfectly safe to eat in moderation, even for those with thyroid issues. And soy is also generally safe, as long as your iodine intake is adequate. So, how can you apply all of this information in a practical way? If you are experiencing persistent symptoms like fatigue, unexplained weight changes, mood swings, or heart palpitations, don't just dismiss them. It's worth asking your doctor to run a thyroid panel. When you do, advocate for a complete panel. Ask for not just TSH, but also free T4, free T3, and thyroid antibodies to get the full picture of what's going on. One of the most powerful things you can do is track your symptoms alongside your lab results. This helps you and your doctor see the connection between your numbers and how you feel, allowing for more precise adjustments to your treatment. Remember, the most effective approach combines medical treatment with optimal nutrition and a healthy lifestyle for the best possible results. Your thyroid is a small gland with a big impact. But the good news is that most thyroid conditions are highly manageable with the right diagnosis, treatment, and nutritional support. You don't have to suffer in silence or feel confused by conflicting information. If this video helped clear up confusion, give it a like and share it with someone who might be struggling with thyroid issues. Knowledge is the first step toward feeling better. And don't forget to subscribe. We'll be diving deeper into Hashimoto's Graves' disease and specific thyroid nutrition protocols in future episodes. Together, let's make thyroid health less confusing and more empowering.